When somebody comes to see me for a knee problem that they've been dealing with for a long time, the difference between insurance-based care and direct care, cash-based practice care is stark. I'm Dr. Ariana Demers, the queen of Orthobiologics, and I am leading the way in orthopedic surgery innovation and shaping medical practices for success. So they've been doing the insurance-based care and they've been jumping through the hoops, and they had to make an appointment with their primary care, and then they saw their primary care, and then they got referred to the orthopedic surgeon, and then they had to wait 6 weeks, and then they saw the orthopedic surgeon for 7 minutes, and then they sent them to PT and they had to wait 6 more weeks, and then they went to PT, and this whole time their knee is still hurting and they don't even actually know what the problem is.
Don't forget, if you want more about the business of Orthobiologics, I have a podcast, or you can go on my website, The Business of Orthobiologics, and tune in.
And so they go to PT and they're not better, and they go back to their orthopedic surgeon and they're like, oh, well, maybe we'll give you an injection. And so they get the injection, and then turns out they're still not better. And then finally they're like, well, shoot, the injection didn't work. Maybe we should get an MRI. So they finally get the MRI. They go back to the physician and they talk about what the MRI says, and they are told, oh, well, you need surgery. And they're not given any other choices. They're not getting anything else. And they're like, wait, what? I went through all this stuff and now I need surgery? Like, I'm so, what? Okay, well, I mean, I guess that's right. And then, maybe one of their friends or their family is like, whoa, have you ever heard of this other thing? Maybe there's Orthobiologics or some other, like, can't you go to massage? Can't you get acupuncture or chiropractic? Won't that work? Here, I have this new brace that you can try. And they're like, well, why didn't my surgeon tell me any of these options? In contrast, when someone comes to see me, they get to spend an hour with me, and we go through their entire history, what has been done, what they've tried, and what their diagnosis may or may not be. Now, sometimes we have x-ray, sometimes we have MRI. If we have all that, man, it makes it super easy, because my first job for my patient is to give them the right diagnosis. And that's all their history, all their imaging, their physical exam, and anything else that they've tried and done. My next job is to give them some quick wins based on their goals. What do they want to be achieving? Do they just want to be out of pain? Do they want to get back to their active lifestyle? What are we doing? And then if they don't have an MRI, well, we recommend cash MRI. They can get it within 1 week. They don't have to ask for approval from their insurance. And if we think that's what their next step is that they need, they get the MRI, they come on back. We can offer them either a phone call, if that works better for them, to go over it, or they can come back in and they can hear about every single one of their options to treat the problem that we know is happening in their MRI. And we create a treatment plan for them to achieve their goals at that visit. And now they're on the road to recovery. That is a very stark difference. And that is what cash-based practice allows me to do for my patients, instead of jumping through the hoops of insurance-based care. The patient gets strung along, and they're no further along. They've been basically entertaining themselves with these things that they don't even have a diagnosis for, and then be told that the only other option is surgery. Whereas if we can get all the information in one really efficient, effective visit, or maybe two if we need to get an MRI, and get them on the road to recovery, that is so different, and it is so valuable, not only for the patient, but for me. Like, I can help them. I know what the problem is. I can tell them all the solutions, and we can get a plan together for them to be able to get better. And they say, oh my gosh, this is amazing. I've never had care like this. And you said, yes, that's because you were stuck in that system. Once we step outside the system, then we can just care for you.